All right, in this recording, we are going to look at muscles of our thigh. So our thigh kind of anatomically is in between our hip and our knee. So the where we kind of generally think of our thighs being, that is our thigh region. So where we have our quads and we have our hamstrings, this is all in the thigh region, okay? All right, so we'll start, and the thigh, the upper leg is divided into different compartments. And like we mentioned in previous videos, muscles in one compartment tend to have the same function, okay, for the most part. And this is what we'll see here. So we'll talk about the anterior compartment, then we'll talk about the medial compartment, and then we'll talk about the posterior compartment. All right, so if we're looking here on the left side of the screen, but on the right part of the body, we'll look at our quads first. So we'll look at the anterior part of our thigh with these anterior compartment muscles. So if we zoom in, we can see these muscles right here in this anterior part. And the first one we'll get to is something called the rectus femoris. Okay, so if we can click here, the rectus femoris, rectus means straight and femoris means femur. So this is the straight muscle on the femur. Okay, this muscle attaches to the anterior inferior iliac spine on our ilium, and then attaches down to our quadriceps femoris tendon and the patellar tendon attaching down to our tibial tuberosity. So when this muscle contracts, it's actually going to extend the knee and at the same time flex the hip because it crosses both of those joints. It crosses the hip joint proximally and it crosses the knee joint distally. All right? So that's the rectus femoris. So that's one muscle of our quad. So think of the term quad. Quadriceps, this quadriceps muscle group, means four-headed. So quadriceps means four heads, and this is the four-headed muscle group on the thigh, in the anterior part of the thigh. So the second muscle is known as the vastus lateralis, okay? So this is the lateral compartment over here, or the lateral part of the leg, so this is the vastus lateralis. If we move the rectus femoris, we see one called the vastus intermedius, and then we have one called the vastus medialis, right? If you are to extend your leg at your knee and flex your thigh, flex your quads, you should feel, and you can generally see the vastus medialis contracting, and you can see it relatively easily, okay? So the rectus femoris, and then the vastus lateralis, intermedius here, and then the medialis, these make up our quadriceps muscle group, okay? These muscles all attach to our femur proximally on the anterior and lateral surfaces, and then they converge on that patellar tendon, or that quadriceps femoris tendon, onto the patellar ligament distally, this is the patellar ligament here, and this is the quadriceps femoris tendon right here, or this is the patella that is engulfed within that tendon, and then they come down and they attach to the tibia, specifically the tibial tuberosity more distally, and these three muscles, vastus lateralis, intermedius here, and medialis, these all serve to extend the leg at the knee, so they're not acting on the hip, okay? All right, the last muscle in our anterior compartment, it's not part of the quads, but it's still in the anterior compartment, is this very long muscle, the longest muscle in our body, known as the sartorius, okay? So this muscle highlighted in blue here is the sartorius. It sweeps around, and it sweeps around from the ilium and goes all the way down across the thigh, into the inside of the knee, and then attaches onto the tibia, all right? So this muscle, if you notice, it attaches to the ilium, the anterior superior iliac spine, and then it attaches down to our tibia, just kind of on the medial side of the tibial tuberosity. And so it crosses both of those joints. It crosses the hip joint proximally and the knee joint distally, and so it's going to act on both of those. So we'll see it serve as a flexor of the hip, and it also will flex the knee at the same time. So it actually flexes both of those, okay? The reason it flexes the hip, or flexes the knee and not extends the knee, is because you can see here, it kind of runs on the posterior aspect of the knee. So by virtue of this location, instead of extending the knee like our vastus muscles and the rectus muscles, so the quadriceps, it's actually going to flex the knee. So it flexes it instead of extends it, okay? So that is our anterior compartment, okay? Anterior compartment leg muscles. So if we look over here, and I'm going to hide some of these here just to make some room, we'll get into what's called the medial compartment leg muscles, okay? These are largely going to be known as our adductors, or our adductors. So these are muscles that adduct and bring the leg back in closer to the midline of the body, okay? So because these are termed adductors, most of their names start with the term adductor. So we have the adductor longus first here. So this muscle attaches from our pubis down onto what's known as the linea aspera, which is this kind of posterior aspect, this posterior line of our femur. So we have a adductor longus. If we have a longus, we probably have a brevis, and so that's what we see right here. So also attaching from the pubis onto the linea aspera of the femur. We have one known as the adductor magnus, which we see this large one here, this adductor magnus. And then this opening in the adductor magnus down here that you see distally, that you can see right here, this is known as the adductor hiatus, which is an opening that allows some vessels to pass through. And then we have one known as the gracilis. So the gracilis is this one right here. Okay, so this is not only going to adduct the hip, but it can also serve as a slight flexor of the knee as well. Again, just because, similar to the sartorius, it runs kind of posterior to the knee joint, and so it's going to act on that joint by producing flexion. Okay, so these adductors are going to adduct the leg, and they can also serve as some rotators of the hip as well. Okay, so they can cause slight medial or internal rotation of the hip. Okay, so that's our medial thigh compartment. If we flip around, we get to our posterior thigh compartment. Okay, so if we start here, we'll have three main muscles here. We're going to have something called the semitendinosus, semimembranosus, and then something called the biceps femoris. All right, so we'll start with the semitendinosus. So if we're looking here on the left, this is going to be our semitendinosus right here. All right, the term it gets this term semitendinosus because it has this very long tendon. So you can see right down here, right behind the knee joint, it has this very long tendon. This is attaching onto our ischial tuberosity proximally and running down and attaching onto the medial surface of our tibia. We have the semimembranosus, which is just deep to that. So here's the semimembranosus in blue. It's attaching in similar regions. So it's attaching along the ischial tuberosity and along to the medial surface of the tibia. And then we have this one called the biceps femoris. Right. So the biceps femoris actually has two parts. It has two heads, if you will. It has a long head here that's highlighted, and then we can see this smaller short head. The long head crosses the hip joint and the knee joint, so it's going to act on both. So it's going to extend the hip, and at the same time it's going to flex the knee. Whereas the short head that we see highlighted here in blue only crosses the knee joint, so it only acts on the knee, and it serves to flex the knee. Okay, so all of these, the biceps femoris, the long head specifically, semitendinosus, and semimembranosus, all serve to extend the hip as well as flex the knee. Okay, so they're very powerful flexors of the knee, and they can also extend I'm sorry, these are not extending the hip, but they're largely flexing the knee. So if you think about flexing the knee, if you bring your knee from an extended position down into a flex position, you can feel your hamstrings contracting, and this is the semitendinosus, semimembranosus, and this biceps femoris. Okay, so again, biceps femoris, just like our biceps brachii, two-headed muscle, but now instead of brachii on the arm, it's femoris on the femur. Okay, all right. The last few muscles we'll look at are our gluteal muscles. Okay, and we have three general gluteal muscles. So we have the gluteus maximus that we see here. It's attached to our ilium and goes down and attaches onto our gluteal tuberosity of our femur. So here's our gluteus maximus. We see gluteus medius right here. So here's our gluteus medius, again, also attached to the ilium and running down onto the greater trochanter of the femur. And then underneath that, so we have to hide it, we get this very small gluteus minimus. Okay, this also attaches on the posterior aspect of our ilium, and again runs down and attaches to the femur on the greater trochanter. Okay, now the last one that we see here is something known as the tensor fascia latae, okay, or lati, however you want to pronounce it. So this tensor fascia lata is a small muscle here that you see highlighted in blue. It attaches from our anterior superior iliac spine down onto our iliotibial tract, sometimes called the IT tract or the IT band, okay, which is this white connective tissue that I have highlighted in blue here. So it attaches there, runs onto this IT band, and then this IT band comes down and attaches actually to the head of our or not to the head, it attaches to the lateral aspect of our tibia here. Okay, so here's our tibia, and then here's that IT band as it travels down, and this can serve to via the tensor fascia lata, as this TFL here, can serve to both flex the hip joint and move the knee joint slightly. Okay, so a little bit of lateral rotation of the knee joint. Right. So lots of muscles here. When you're learning them, I would learn them and approach them by compartment. So start with the anterior compartment muscles that are largely extensors of the knee and flexors of the hip. Go to the medial compartment, which are adductors, and then you can rotate around and you can find the hamstring muscles back here, right? And with the hamstring muscles, these are largely flexors of our knee. Okay, all right.